I'm Zaid Shalchi, and today we're going to be talking about laser capsulotomy. So, laser capsulotomy is a painless procedure done with a specialist laser called a YAG laser. It's performed to primarily treat posterior capsular opacification. This is a misting of the bag that holds the intraocular lens in an eye that's had cataract surgery. Posterior capsular opacification happens in about 20% of eyes after cataract surgery. In some cases, laser capsulotomy is used to treat anterior capsular phimosis, although this is much less common. The procedure is a routine procedure and is performed in clinic. After a patient's vision is checked, drops are instilled into the eye to dilate the pupil and then numb the surface of the eye. The patient is then taken to the laser room in clinic, when a friend or a family member can actually be there in the room with them, as long as they wear some safety goggles for the protection of their own eyes from the laser. The laser is actually attached to a microscope that's identical to the slit lamp microscope that's used in clinics, so it's not something unusual. And a contact lens is placed on the eye to stabilize it. The procedure really doesn't take very long, typically about 5 minutes, and is completely painless. After the laser, drops are instilled in the eye to keep the pressure down, and then some other drops may be used at home if there is a risk of inflammation. The procedure really is very effective and very safe, so thankfully complications are rare. The pressure in the eye can rise afterwards, and this may need to be treated with drops, and also if there's any inflammation in the eye after the laser, that may also need to be treated with drops. The intraocular lens of the eye may be damaged by the laser, and this is known as lens pitting from the laser. Thankfully, this is usually avoided by just focusing the laser away from the lens. Floaters can increase after the procedure. Thankfully, this is rare, particularly if the laser technique is good. And there is also a theoretical risk of retinal detachment after laser, but this has never really been borne out from any studies. Patients naturally ask about alternatives to the laser. Unfortunately, there are no drops that can be used to clear posterior capsular opacification. So treatment is either with laser or with an operation, which is normally more invasive. That's why when the condition is mild, we normally recommend no treatment is done. But when patients do have a problem with their vision, particularly if they're having reduced vision or glare, then laser is deemed a very safe and very effective treatment for posterior capsular opacification.